60% chance of getting pregnant before the age of 18. Now, if you consider that half of all the girls in this country become pregnant by the age of 19, and you know that absolute poverty in Uganda, out of 10 people claims 3, and poor people in Uganda, if you add together the absolutely poor and those who are basically poor, they contribute over 60%.
Yes.
Of the population of Uganda.
Right.
And you also consider that we have a very high dependency ratio. You know, women are producing 7 children, but these are women who are poor. How are they going to feed them? How are they going to clothe them? How are they going to give them proper medication? That's why children die. Because I need transport to take this child to hospital. And I don't have, if I take the child to hospital, I do not have milk, because I can't eat well to produce the milk. So I'll give the child black tea, and the child will become stunted. And because of that, the child will be prone to diseases. And because of that, I will not go to hospital. I'll go to hospital for malaria, and then the diarrhea, and then the third time, because of poor feeding, the child will die.
Yes.
Yeah. So we have
vicious cycle.
We have a very big vicious cycle of culture. Now, the other problem we have is the breakdown of culture. When did you last hear this song? Nsanji 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 mwana wange tonamera bere boli mere bere nsanji ndigena nawe. When did you last hear?
Right.
We no longer have these culture values
songs
because of television.
Right.
No,
television is mentoring our children.
So television is mentoring children for us, but the culture which was there protected our parents and us from early sex, because we were taught what to do. But today parents think teachers should talk to their kids about sex.
They get home.
And then they get home, the parents just mind about the homework. Yet it is not about the homework. It is about, you have to parent.
Sit down.
And the parents say, I can't talk to my child about sex because the child is 15 and she's too young. By 15 in Uganda, kids are already having sex. So what you fear to tell them, they already know.
Right.
And because you're not saying anything about it, they think it's okay.
There's an information gap.
Yeah. So there is something I really want to propose. It is I would want the Communications Commission to demand that every romantic movie shown on television should be shown after 10 p.m.
Yes.
I did that research in 1999.
Yes.
And they did something about
that should be a standard thing.
Yeah. But right now, if you see what is going on our Ugandan televisions, you'll be shocked.
Could have it for breakfast.
Yeah, it's breakfast at 2 p.m., 4 p.m. when kids have just gone home. All those funny
movies. They should wait until they are in bed before those movies are shown.
Now, on every romantic movie, they should put a disclaimer.
Right.
Like the one they put on a political talk show. That
the views expressed.
Because kids do not see the linkage between a kiss and a baby. They don't see a linkage between a kiss and pregnancy. So the movie shows that this girl went in, had sex, and the next day she was okay. They don't show that this girl got or this boy got an STI. So in their minds they think, nothing goes on. And in these movies, they do not show people using contraceptions or even barrier methods for HIV and pregnancy. So it's like they are showing them a world that doesn't exist. And in communication, we call that socialization. So they socialize people to think in a world that doesn't exist. So by the time we bring in this kind of information, it can't sell. Why? Because it is not packaged in a similar way to the one in a movie.
Right.
And two, we are not using white people that are appearing in a movie. Things like that. So I would think we need to, first of all, go back to our quality. 3, we need to keep girls in school. There is nothing that works better than a girl who is informed. By the time a girl crosses S4 without a child, if they continue in school and they begin to see A level, they now begin to focus on education. When they finish A level and they have somewhere to go, they consider school more importantly, and by then they can weigh priorities. But when they do not have anything to look at up to, even this cheap sex with boys that they can't even stand up to after 5 years will not actually take place.
Well, interesting, heavy stuff there. Margaret, what can we do about mindsets? Because you might have the contraceptives and the women might say, oh, I'm not really sure.
In fact, he talked about the young person, really. They have problems, These people, the young children, they lack information, correct and clear information, which he has mentioned about.
Right.
So we need to have real correct information to difference modes of communication strategy. Then, there is a lot of rumors and misconception. When you do like this, you get this. So really, an empty mind, you add the rumors and misconceptions. He talked about pornography, mass media.
Yes.
Mass media is really doing also some harm to these people because of anything which is being shown.
When you talk about pornography, what exactly?
I don't know. He talked about the.
Well, let's talk about the Ugandan mass media. What
mass media? What I was trying to say about, like what they are saying on, let me say, in papers, red paper, the television. The people
is that pornography? What you see on television?
No, what I mean, there's romantic movies, and there is a lot of movies which shouldn't even really shown to children. There is a lack of parental guidance. Parents are very busy. For example, I'm here. By the time I reach home, maybe
children are asleep.
We don't have time for the children. We are leaving the roles to the teachers. Then there is no youth-friendly services. They are very limited. They are in a dilemma. They don't know where to go.
What do you mean youth-friendly services?
Youth-friendly services, when you go to these health centers, you find old women whom, when a young girl comes, is thinking that he's already judged. This is my daughter. He's asking for contraceptive. Said now already. How she has already got sex? Yeah.
I'm going to tell your mother.
And even remember, this young girl making a decision that she should go to the health center. She has made a lot of effort. To and fro. Should I go? Should I not go? No, let me go. Now once she meets mama's friend, she's really scared.
She goes
those are the youth-friendly services. Remember, there is physiology. The bodies are growing.
Yes.
He mentioned that 15 years people with the reproductive health have really grown.
15 years around senior 3 years.
Senior 3, from 12, let me say. So
P7.
Then there is peer influence.
Right.
People are saying, let us go. You don't have a boyfriend. Let us do this. So they are also discovering. Let us do this. And the poverty, we started with poverty. Poverty pushes you. Seeing the friend, the peer is having this, I have also to do this. So at the end of the day, we are ending up with the high teenage pregnancies. And coupled with the poverty, as he said, and already it is evidence, as he said, that over 60% of people are poor. So definitely, our children, if you are from a poor family, definitely also you will be poor. Okay?
It's called a vicious cycle of poverty. You are poor because you are poor.
So really, we are in that mystery, and it is rotating even to our children like that. We need to do something. Wake up. All right.
Isaiah, as you maybe respond to that, let's talk about, in the past we used to have community centers, Mbuga community center, and so whether young people will go and mentor each other, how they can have someone talk to them. Is the death of that kind of institution contributing to this kind of things?
Hugely. It's hugely contributing. We have to look at several issues. First of all, half of the people in this country are below the age of 15.
Half of
this country is under 15.
Yes.
That in itself is a challenge, but again, that in itself is a huge opportunity. They call it a demographic gap.
Yes.
Once we lose this demographic gap,
it's gone.
It is gone, and it will not come back until maybe another 100 years. But if we can harness this demographic gap, give these kids skills, because at 15, if half of this country is around there, I assure you in the next 15 years, this population would have doubled.
Yes.
Because everybody who is 15
from 33
under normal
to 66
under normal circumstances
live here with all their oil, they are only 6 million.
If the trends continue the way they are,
so we need to it's an urgent matter. We need to slash.
We should have started yesterday.
In China they said 1 child per person for some time. Now they're easing it a little bit.
Now listen,
what is the ideal? How many children should a family have on average? 2 children?
We cannot set that, but with our economy,
for to manage it,
you gauge yourself.
With our economy,
we've done a study called the Child Cost Index.
Yes.
It takes 48 million to raise a child in Uganda from the day the child is born or conceived up to the time this child leaves your home to go and start their own family.
48 million.
48
Child
million.
costing us.
So you think about it. How many people can afford that money? So you look at your pocket and see what you can afford. The days of producing to whom it may concern are over. People must think. I mean, I am educated, I've got a job, my wife works, but we can't afford more than 2 children. We can't. To give them the kind of life they need to have. And some people brush me off and they say, what? But sometimes I want to go on a holiday. I want to put my whole family on a plane.
Right.
But if I have 4 kids, each ticket is 400 shillings if I'm going to Mombasa. Just think about it.
Right.
I have 4 kids plus myself and my wife. That will be a big number. But we are 4. We can fit in the smallest car available, you know. So we need to take care of this demographic gap. 2, we must provide correct information. You go out there, even at university, you'll be shocked what kind of information these girls have.
Yes.
They'll tell you if you have sex standing up, you can't conceive.
At the university?
Yes. They say if you take Panadol with a Coke just before sex, you know, you can't get pregnant. They say if you bathe immediately after sex.
One president said that
if you jump up
because he took a shower.
Yeah. If you jump up and down after sex,
if you're a woman, everything goes down.
Everything goes down, and you can't can't conceive. Yeah, these are university students.
Different from the village woman. Campus girls, not different from the village woman. I can see that headline. Go on.
So, if we put all this together, these are the people who are producing unwanted children.
Right.
Sure.
And we also have the older adults who are also thinking. Some people think they can use witchcraft to stop themselves from getting pregnant.
Oh.
Yeah, I mean, I've done
Put something under the armpit?
No, not under the armpits. May I put something in the anthill? As you put it there, don't look behind them, you know. But how can an anthill stop you from conceiving? You know. So until we deal with all this and get rid of the unwanted children, because it's not about children, but it's about the effect it puts on you.
You're saying the 7.2 average an Ugandan woman produces
6.7.
6.7. It's gone down to 6.7.
Yes.
The last time I looked was 7.2.
Yes.
So out of those, many are actually unwanted.
Actually, I can tell you 775,000 babies born in Uganda are conceived unwanted.
Oh, really?
Yes. So and we have 1.2 million
services to remove the unwanted. What would be our demographic? What would be our figure of that?
It would be very low, because
6.7. What would it be? 4.2. What?
Because women desire to have between 3 to 4.
So would that bring it down to almost have it?
Yeah, we'll have it.
Well,
and then if we keep the girls in school who are contributing a quarter of all births, then we will kind of deal with it.
Let's hear from the listeners. This is Spectrum on numbers tonight: 0414-348-111, 0312-260-390, 0312-261-390. When you call in, please tell us your name and where you are calling from. Spectrum, hello. Oh, we lost that caller. All right, Spectrum, hello.
Hello.
Yes, sir. Your name?
Thank you for that demographic talk. As far as I'm concerned, my name is Peter. One of the biggest drive of our population is poverty. Because if you look at some of our extended families, you find that the well-to-do actually have less children compared to others who are not doing well. Because for the guys who are doing well in terms of finances, they are busy, they have jobs, they have electricity or light. And the majority of the people who are poor, actually, their only consolation is to have bed, is to go to bed and make babies. So it is poverty which is the biggest driver and something which we should all fight, as opposed to some of these guys who have, I think, not the best practices which they are trying to emphasize. Let's fight poverty.
All right.
Thanks.
You're very clear message. Letters. Spectrum, hello. Hello.
Hello.
Yes, your name?
Hello.
Hello, madam, your name?
Hello.
You're live on Spectrum. Your name? Okay, we lost that lady. Spectrum, hello. Hello.
Hello.
You're live on Spectrum. Your name?
Good evening, Spectrum.
Good evening. Your name?
I'm Joanne calling from Namuyombo.
Yes, John, please go on.
While I appreciate that one of the ways of cutting down on our slowing down our population growth is through family planning, there are some places where the services are way too expensive for a common, I would say, a common woman. I went to family planning the other day. Is it
Where?
FP, Family Planning Association of Uganda?
Yes.
And I was charged 35,000.
For what?
Isn't that
Okay.
isn't that quite high?
All right. We'll get a response to that, John. Spectrum, hello? Hello?
There's no one.
Your name?
Hello?
Hello, your name?
Hello?
Hello, you're live on Spectrum.
Good evening, Edmond.
Good evening, your name?
My name is Rita. I'm calling from Namuyombo.
Rita, yes?
I'd like to congratulate our speakers in the studio this evening on this very, very topical subject. I think the speakers have been very eloquent and put the issues forward. The issue is one, as they said, the unmet need to family planning. And as just the previous speaker said, these services are not available for the women. There is also issues of gender and power relations. How and when, how many children a woman can have, does she have that power to determine? We have issues of culture and religion that are deeply enshrined in our attitudes, our beliefs, and unfortunately this is actually perpetrated by even our political leaders who should actually be guiding the population. They are looking at population only as voters, but not the quality of population we have. And I really want to call upon the speakers in the studio this evening to take this type of information to policymakers, and let us start looking at these issues as economic issues, as development issues, and political issues, governance issues. We are not making any headway. Thank you very much.
All right. Final caller, Spectrum, hello? Hello?
Hello?
Yes, your name?
Oh, my name is Aisha Kawanda. Good evening, Spectrum.
Good evening, Aisha.
Two issues. Number one, I would personally attribute the escalating population to unstable relationships. We have seen situations where people are having extra children they wouldn't have had, but because they have changed the relationship. So let's look at that as a factor more than the accessibility to contraceptives, as they put it. And then the question to them, we have heard that contraceptives increase the risk of a person to get HIV, to be HIV infected in case a negative person gets into a relationship with a positive person. What is their comment? Thank you.
Thank you very much. Indeed, Margaret. Your response.
All right, thank you very much. I didn't get the name of the first one.
The first one was Peter.
Oh, Peter, that was very good. He really attributed it clearly that high poverty contributes to all this. It was, in fact, a supplement to the discussion. There was no question. Then Joan from Namugongo, she mentioned about services being expensive. You know, sometimes some service delivery points are offering comprehensive, integrated section reproductive health services. Yes. Not only family planning alone. Maybe they have some other gynae problems. Maybe they have some other, let me say, maybe malaria, or, you know, it is comprehensive. So the charging is made maybe together. It is really known in Kampala. Some, you go to a clinic, definitely you can even pay like 60,000. Okay, so we are really putting a lot of emphasis on contraceptives. Honestly, contraceptives.
But it's high. Government should work to reducing it.
Yeah, government is really working very hard. And as I quoted in a meeting where the Director General of Ministry of Health was really emphasizing, she was also almost crying that contraceptives should really be accessed by every woman in Uganda. This one is their effort. They are really working tirelessly day and night. And she also mentioned about the unmet need for family planning, which is really very high. We appreciate this and we know this. It is meaning, only this even is saying that really many women are yearning for the methods, but they are not what? They are not getting. But really the methods are there. We are providing information, and there are several strategies really which are being made. How should people get these contraceptives? And they have made even alternative distribution channels through people, let me say the private sector, they are getting it from the UHMG, then the government is getting it from the national medical stores. Really, they are working hard. A lot of strategies are being really done to ensure that every woman get really contraceptives if they need. This one gives us hope if really people are yearning for them. So then it is to our side that we should ensure that really these methods are accessible to the people who want them. Issues of lack of knowledge, issues of rumors and misconceptions should be really worked away with. Issues of really clear understanding how do these methods work. Once people appreciate that and they look for the methods, honestly, believe me, we shall work a long way reducing the maternal mortality ratio, which is very high.
Isaiah. Sir. Well, I mean, an interesting point that came in through Aisha, multiple, some have called it serial polygamy, multiple, but you marry a woman, you separate, and you marry another one, you have to start afresh, in quotes somehow. So she says that could contribute. That's a new perspective.
We kind of knew about it, but let me respond to a few things. One was about contraceptives and HIV.
Yes.
This is what happens in Uganda. Women fear pregnancy more than they fear HIV. Because pregnancy has quick results. It shows quickly. HIV doesn't.
So how long does it take for HIV symptoms to show when one catches it?
Idea. It can even go up to 30 years.
30 years.
Now with the introduction of ARVs, definitely.
No, I'm saying before, from the time you get it to the time you realize you have it, how long would it take?
The window period is 8 weeks.
Within 8 weeks you should know it.
But there are even some tests which can detect the what? Immediately.
All right,
yes.
go on.
So that is key. Now, if we are going to solve this problem, we need to, the gender problem, we need to educate the women, because a woman who is educated knows her rights.
Yes.
You cannot push her. A woman who is educated and is employed is in a better position to be in control of her life. A woman who is educated is empowered. Somebody who is educated and they have a job, they are empowered. You cannot just tell her you are my wife, whatever. So, and if she's unsafe, she'll tell you I'm not safe and I'm not ready to whatever. But let me go back to two things. One, contraceptives. When contraceptives are available, some women who fear pregnancy will not worry about HIV as long as they're not getting pregnant. So we now need a drive to actually put this information on every contraceptive, or put a disclaimer on every advert.
It's not protection against
that this thing only provides protection against pregnancy, not against STIs and HIV. The other thing is, I think any man who has a privilege of making a woman pregnant should have a responsibility of escorting her to the labor ward. A man who has not been to a labor ward will just sit, cross his legs, read the newspaper, and wait for a wife to deliver, and then ask her the first week when she's back, so when are we adding another one? But a man who has been in the labor ward
knows what it takes.
Because women go through death to give life.
You even remind, have you taken the pill today?
Because he remembers the screams outside of the labor wards as he paced up and down in the
Yes, I have a friend of mine who who fainted
when he heard the screams.
Yes, when he saw the baby coming out.
Actually went in there.
He collapsed.
We have to end on that note. Thank you very much, dear guest.
We have some. We do have the launch of the report tomorrow.
Yes.
At Imperial Royale.
Yes.
At 1:30 p.m.
Imperial Royale 1:30.
Imperial Royale. If you want a copy of the new information that we've come out with after our research,
be issued tomorrow.
Come. It's free
tomorrow,
as long as they're there at 1:30 p.m.
1:30 tomorrow at the Imperial Royale.
Yes.
Thank you. very much, that your guest, Mr. Isaiah Mbuga, National Program Officer at the Information and Communications Department in POPESEC. POPESEC is the Population Secretariat, it's a government body. Thank you very much indeed. Also, Miss Margaret Demeter Namuyombo, Medical Coordinator at Reproductive Health Uganda. Thank you for tuning in and for calling in as well. I've been your host, Edmond Kizito. Spectrum, we'll be back tomorrow. Up next, there is a news in English. Do stay tuned.
Life is like a race. Richard switches on his BlackBerry and is off. He is sending 3 BlackBerry instant messages to his friends. He's operating at speeds his co-workers can only dream of. He's taking pictures. His email.